Support for this work was provided by the New York State Health Foundation and Care Compass Network.
Thank you for joining us. My name is Jack Salo, and in this video we hear from Ruth Roberts, Director of Community Services at Chenango County Mental Hygiene and Behavioral Health Services. Addressing health issues related to mental and behavioral health accounts for a large percentage of overall health care costs. From her perspective as leader of Chenango County's Mental and Behavioral Health Services, Ms. Roberts shares her experience with DSRIP and offers sage advice for organizational leaders considering value-based payment. We have featured local government service providers here and in another training video because of the essential role they play in service provision to vulnerable populations, especially in rural counties and communities. It will be important for county-level service providers to be active partners in value-based payment if we are to effectively serve rural populations in New York State.
My role is to plan and monitor the entire system of services for individuals who have a mental disability. So mental health, substance abuse, and intellectual and developmental disabilities. So that requires me to have a macro level, to certainly work with state and local government, to work with the local provider system, and to advocate for the services that we need in the county. So the running of programs is part of my job as well. But all in all, the mission is to provide the necessary supports and services so that individuals who have a mental disability can live successfully and be part of the community. We're part of the CBO network, but at the same time, we're a health provider and we're part of the healthcare system. And so I think we have our foot in both worlds. So I think there are opportunities as a medical provider, but also as a community-based organization to kind of push our way into the physical health provider world and have opportunities to provide services and treatment in a real coordinated, integrated fashion. I think initially I wanted to be a part of that because the saying is, if you're not at the table, you're likely to be on the menu. And I wanted to make sure that, I was at the table, and that, again, going back to, my role as the DCS and the need to advocate for services here at the local level. So, I think a lot of us in the room were just not really sure what was going to happen, but we wanted to make sure that we were at the table. As things kind of moved along, I realized, really how big this DSRIP initiative really was, and started to think, more carefully about where do we fit in. There's far greater effort made now to connect with primary care providers, to connect with any specialists that our folks are also seeing, and to not only make that connection, but bring that information into our treatment planning and treatment process. I think to some degree we did that, but in a much smaller way, where these projects have really pushed us to pay greater attention and to make much more effort to coordinate the care and bring in that physical health information. So everybody's busy. Our primary care providers are very busy, and everybody is in some ways overwhelmed. And so it's the sort of thing that could easily get pushed aside, and because people or providers feel like they just don't have the time to do that. But I think as a result of these projects and working more closely with primary care, I think we all see the benefits. And in the end, it really makes so much more sense for the patient when all of the providers are actually communicating and working together towards those desirable health outcomes. We serve in our priority population are individuals who have multiple disabilities. They are seriously mentally ill, or they have a serious chemical addiction. They're complex. Their needs are complex, and I'm concerned about, you know, this future value-based payments. In my mind, it's similar to a total managed care environment. I'm just concerned about how are we going to ensure that this vulnerable population is able to get the services and supports that they need from the healthcare system in this new landscape of reimbursement. And so that's one concern I have. Another is how it's all going to shake out from a fiscal perspective. I'm required to, and I'm in the middle of the process right now for 2020, I'm required to develop budgets and go in and present to the county board of supervisors and go through the process of having that budget put in place. I am able to make projections in terms of revenue based on our experience and knowing, you know, for certain services with the CPT code, this is what we get reimbursed for. And so I have something to work with and build off of. I don't know what that's going to look like in a value-based payment environment. And it'll be interesting when I go in to the Board of Supervisors and present that budget, because I'm just not sure how that's all going to shake out. I believe in this work that we do. I believe it's so important. We see people making changes in their lives every day. We see people sometimes at the lowest point in their life. And yet, I want to make sure that we continue to have opportunities to engage individuals and provide the services that they need. So, as far as preparing for the future, you know, a lot of work is being done in terms of preparing this organization for change. And organizational change is always interesting. And, you know, there are some folks that will be early adapters, and there will be some folks that I'm sure will say thanks but no thanks. I'm going to go find something else to do. And that's probably what needs to happen. I would say fasten your seatbelt, enjoy the ride. You know, we've gone through big changes before. I've been in the business long enough to be able to have that perspective. We will figure this out, we will get through it. And then along with that is, don't try to do it alone. Don't go at it alone. You know who your partners are, know who you can rely on to help you and your organization be successful in this new landscape. I don't think there's this master plan at DOH about how this is all going to look, okay? I think a lot of this is going to be determined and driven by the provider system. And so if you're a leader in an organization, I think one of your responsibilities in all of this is to make sure your voice is heard regarding what you need in order to be successful in this new landscape of value-based payments. And stick to your mission. You know, we have the tagline for our mission here is promoting hope, wellness, and recovery. And everything we do has to relate back to that, promoting hope, wellness, and recovery. And so my advice to any leader of any organization, stick to your mission and don't go it alone, and you can't be everything for everyone. So that would be my advice.
Support for this work was provided by the New York State Health Foundation and Care Compass Network.